very happy to be with you this evening. It's been a while. So tonight we have a returning guest with us, and we also have a visiting doctors. But first, if you have any questions, you can contact us through the following means. Welcome back. So this week we had a very interesting event. It was the first Vascular Disease Awareness Day that was hosted in Holiday Inn. It also has something to do with our guests tonight. So we're going to show you this short report that we took on that day. So let's have a look.
Dr. Hussein Safar, regarding this conference, this is the first conference we do for the public about vascular disease awareness, so the public, they know what's going on with the vascular disease in Kuwait. And the target people is all patients with diabetes, hypertension, and hyperlipidemia, with patients with high with ischemic heart disease, even a normal patient and patient above 50 years of age. This conference will concentrate on screening for this vascular disease in Kuwait. Is very common, regarding the stroke, how to prevent stroke, how to get to know the disease and the carotid disease, to pick it up early by doing a screening test. And also we teach our patient and the public regarding aneurysm, which is dilatation of the vessels in the belly, which is common in the world, but we don't see it in Kuwait too much, probably because we are lacking a screening test. So we want to pick up this disease early so we can operate or we can treat the patient before they die. Also, we want the public to know about the diabetes and hypertension, how these disease affect the vessels in the leg, and to prevent gangrene, to prevent limb loss. Also by doing screening, to come early to the vascular surgeon, to come early to do screening tests, to avoid disaster like amputation, and nobody likes to get any toe or legs amputated. I hope this conference will get to the public the vascular disease awareness. It is one day condensed lectures. We have international speakers, we have local speakers, and we hope we'll achieve our goal. The conference will be in the morning in Arabic, and in the afternoon will be in English for English speaking.
In our area, especially in Kuwait, we have a lot of risk factors such as diabetes, hypertension, obesity, high cholesterol, smoking, lack of exercise, heart diseases, strokes. These are all risk factors to develop atherosclerosis or narrowing of the arteries all over the body. Our message today is to give a detailed about each disease, how it's diagnosed, what is the best treatment, either by modification of this risk factor, a conservative treatment, or by intervention, angioplasty, stenting, or by surgical approaches.
Hopefully, this sort of symposium or conference would alert the public to the problems of vascular disease in Kuwait. We have a great problem, especially with diabetes being so prevalent, about 20-25%. And in addition to people living sedentary life, no movement, they use their cars everywhere. In addition to the bad habits in eating, they don't really eat healthy food. So hopefully this conference is going to earmark the problems in the society that lead to vascular disease, and hopefully they will take the points and change their lifestyle, and maybe we will decrease on the long run the incidence of vascular disease and diabetes in the community.
All right. So as we saw in our previous report, we had a nice visit to the Holiday Inn where the first Vascular Disease Awareness Day was held. And as you know, this is the first of such that is organized in Kuwait. It was talking about the impact of peripheral artery disease on patients, carotid artery disease, strokes, and AAA or abdominal aortic aneurysm, and also the need for screening as such diseases were never screened before in Kuwait. While we were there, we also had the privilege and opportunity to meet with Dr. Riyad Al-Tarazi, who is a pioneer in cardiac surgery, and he is a consultant cardiac surgeon currently at Cleveland Clinic. So we got to ask him regarding the impact of such diseases on his practice and on his patients. So let's take a look and let's hear what Dr. Riyad has to say to us. Dr. Riyad Al-Tarazi, consultant cardiac surgeon here in Kuwait. Thank you for having this small chat with you, Dr. Riyad.
You're welcome.
So, Dr. Riyad, we wanted to ask, as a cardiac surgeon, how big of an impact is peripheral artery disease to your patients and in your practice?
You know, it's important to know that coronary artery disease and cardiac disease and peripheral vascular disease all go together. Usually people think that if they have coronary artery disease means it's only involving the heart. But the vascular process that has caused the disease involves all the arteries in the body, including the abdominal aorta, including the peripheral vascular, including the brain arteries. So they go all hand in hand. And I usually tell my patients that the heart is the mirror of the body. You know, if there is disease in the heart, means you're going to have disease in the other circulations, and also vice versa. If you have disease in the peripheral system or disease in the carotid artery, it's an indication that there is disease in the heart, even if the patient doesn't have symptoms. So always, when we see one or the other, we like to follow up and investigate. In our practice at the Cleveland Clinic, when we started collecting the data, we found that the most common cause of death in patients that undergo vascular surgery is cardiac surgery. Is myocardial infarctions and heart disease. So we started always doing angiograms electively on patients who don't have symptoms. And we were shocked by the results. There was a very high incidence, about 30 to 40% of people who have no symptoms at all yet have diffuse coronary disease that requires either intervention by angioplasty or by surgery. And I remember one time a young guy, he was a 33-year-old, who had no chest pain, no complications at all, had a femoropopliteal bypass because of limb ischemia and ended with a massive myocardial infarction and died. So we have to really, screening today was a very important day in Kuwait because screening is very important in picking up, peripheral vascular disease, and that could even prevent amputations, prevent strokes, and can also diagnose heart disease and mask heart disease that you can prevent death for that.
All right. Dr. Riyad, as you know, CABG or bypass surgery is an extremely major operation that a patient may undergo. So how is our success rate comparable to those in the Western countries?
Well, I'm going to correct you a little bit. It's not major anymore. 15, 20 years ago, cardiac surgery was major. Nowadays, cardiac surgery is as simple as any operation, and it's simpler because we are controlling the heart. Usually major operations, people die of heart disease, but we are controlling the heart during the operations. And nowadays, with our involvement techniques and myocardial protection techniques and intensive care unit improvement in anesthesia, improvement in post-op care, we really are achieving great results with bypass surgery in the whole world. And in Kuwait, I think our results are extremely comparable to the Western world. Keep in mind that I worked in the United States for 20 years, and I've been in Kuwait for about 14 years now. And you have to say that our results are extremely good, and even better because the patients we see are much worse than the patients that we used to see in the States. The disease here is extremely diffuse, the small arteries, and there's a lot of females with disease here. And if you look worldwide, the mortality of females undergoing bypass surgery is twice the mortality of males. But if they survive the operation, they have the same survival. So in Kuwait and in the Arab world, we see much more diffuse disease. And our results, alhamdulillah, are extremely good, with a mortality below 1% in people who have a normal ejection fraction. You have also to understand that you cannot compare every bypass or every operation with another because they're different. There are apples, there are oranges, there are bananas, and the same thing. You bring somebody who's young with single vessel disease, his mortality is 0. You bring somebody who's 80 years old with a poor heart function, previous stroke, liver cirrhosis, renal failure, on dialysis, then his mortality is going to be much higher than a regular patient who undergoes a simple bypass operation.
One more question. For patients who are undergoing CABG or bypass surgery, what should they expect in terms of recovery and returning back to life?
Usually, the recovery of the patient depends on the patient themselves. We see varied people. We see some people that don't recover fast. We see people that recover faster than others. But usually, in about 6 weeks, most of their patients are back to normal life. The expectations are really that they don't have pain from the chest, sometimes a little of leg pain, and most of the patients can go home on the 3rd or 4th day or the 5th day. Sometimes we keep patients longer because they don't have support at home, and we like to support them in the hospital. After that, the patient, usually most of the patient will have some difficulty in mood disturbances because, now the patient had undergone heart surgery, he's going to start worrying, what's going to happen to me? But most of these are very transient, and patients get back to, they can sleep well after 6 weeks, they can eat well, they return to normal life, and they forget about it. And actually, they are feeling good now. They don't have chest pain, they are not short of breath, and that's going to make them go along, and they're always very happy.
Dr. Riyad, any final advice that you have to our audience, please?
My final advice, which is advice to everybody, is to protect yourself and take care before you develop the disease. And that's why, if we prevent these things to happen, is much better than when they happen and try to follow up. So watch your diet, exercise daily for 30 minutes, control your diabetes if you have or you're diabetic, control your blood pressure, try to lose weight, control your cholesterol by medications, and control blood pressure. Now keep in mind that some things that we cannot change, the fact that if you have a genetic background, you should be even more careful in protecting yourself. And I think with this new screening that Dr. Abdulaziz Al-Muzaini is doing, and looking at screening is going to be even much better. Thank you very much.
So thank you very much, Dr. Riyad.
You're welcome.
Thank you very much.
Thanks.
Welcome back. So we have tonight two distinguished guests with us. First, we have Dr. Chabok from the United Kingdom, a clinical director of Lifeline Screening Clinic. Welcome, Dr. Chabok, to Kuwait. And in addition, we have with us a returning distinguished guest, Dr. Abdulaziz Al-Muzaini, who is a vascular ultrasound consultant. So welcome, Dr. Abdulaziz, and thank you for joining us again for part two.
You're welcome. Thank you for the invitation again. Thanks.
All right. So we're going to start off with our distinguished guest, Dr. Chabok. So we've been talking a lot about prevention and about screening, and this has been basically the topic, or the hot topic that we had in the Awareness Day. So can you tell us about what was in the Awareness Day that we had, the Vascular Awareness Day, and what was the impact of that day?
Yes, thank you very much for giving me this opportunity, and this is my pleasure to be here. First, I would like to start by thanking Dr. Abdulaziz for setting up Vascular Disease Awareness Day, which is a very significant step towards raising awareness in the population and also among the medical community. And when we talk about prevention, this is very important to note that the first step is always raising awareness. So we need to know about the condition, we need to identify risk factors, and then second step would be education provided for patients or for public to know how they can control their risk factors and how they can minimize their risk. So it is very important, and I'm glad to see that we had many participants attending the Congress yesterday. It was very productive, and it was lively debate and discussions around prevention, about the screening programs, and in particular vascular disease. Because as we know, vascular disease is one of the leading causes of death and disability globally, and it's not limited to this country or any specific country. It is all across the world, and it is very important to recognize the importance of these conditions and try to introduce a good prevention plan. So, as we all know, prevention is better than cure, and I think Dr. Abdulaziz Al-Muzaini already started the first step in the country, which is very good news.
All right, so Dr. Abdulaziz, can you tell us how was the feedback that you got from the first Vascular Awareness Day that was organized?
Yeah. First of all, thanks again for invitation. Before starting, I would like to thank Dr. Riyad Tarazi, who you just did. We saw the interview on TV. Because special thanks for this guy. I mean, we are here, Kuwait. We are lucky and fortunate to have him here with us. He's an authority. He's a pioneer in cardiac bypass surgeries. He did a lot in the States, well-known figure. And to come here in Kuwait and build a center and establish a base for the next generation, and he's doing a lot, So we are really lucky to have Dr. Riyad with us. Talking about Vascular Awareness Day, it's a thought being in my mind, and a lot of doctors, really, not only me, long time ago. But fortunately, that at this time we should finish. Stop. We're gonna push it. I'm gonna make it this time. Okay. And it was from the encourage from Dr. Marzouk Al-Badr, the head of vascular surgery in Mubarak Al-Kabir Hospital, and it was also we had lots of encouragement from the Minister of Health, Dr. Ali Al-Ubaidi, and Dr. Khalid Al-Sahlawi. They gave us the all support. Really, the Ministry of Health, even Mr. Faisal Al-Dosiri, you know, when we told him about the Vascular Awareness Day, he was abroad. He reached the country at 1 a.m. Second day, all the papers are signed, you know, for the permission and for the posters. So really, the Ministry of Health, they helped us a lot. Now we'll talk about the feedback you told me. I mean, yesterday, the Vascular Awareness Day, as you know, you was the host, Dr. Dalal there.
Thank you for
and
the
you did a
invite.
great job also.
Thank you.
The first 2 hours, it was awareness for the public. It was in Arabic. And really the ballroom was full of audience, you know. And me and my colleague Dr. Salma Khraibit, we gave a lecture about the vascular diseases, prevalence of vascular diseases, and about TIAs, strokes in Arabic. And I didn't believe that feedback. The feedback started from the same day in the lobby. You know, the audience were stopping me, asking me questions. So in the same day or the same moment, I felt proud, me and my colleague, that we did this awareness day, so that people, Kuwaiti people, are very, very educated, and if you give them the information, they would like to have more, you know. They will go read, they will go and Google it, they go to the doctors and ask. So that's what made us happy. So the feedback was really great from yesterday till today, from my colleagues, the doctors, and from the audience.
That's really true, and we also got feedback on Instagram as well.
Yeah.
Yes. So Dr. Chabok, as part of the Lifeline screening clinic, how? I mean, I think we're a little bit far behind when it comes to screening, and I mean the initiative that Dr. Abdulaziz did was, I mean, it's exceptional, it's amazing. How important is screening, and what is the impact that it has on the country or on the in the nation that it's been implemented on? Sure.
If I may, I'm going to start by giving a brief background about Lifeline screening as a whole, and then I will start, comparing screening programs in different countries, in particular in the UK as well as USA, and I will talk about AAA, which is abdominal aortic aneurysm. So Lifeline Screening is a private company which was established in the US in 1993, and then it was extended to the UK in 2007, and then subsequently to Australia. So the number of clinics that we are running all across the world in 3 different continents, it is in reach of nearly 17,000, 18,000, it's just under 20,000 indeed. And so far we screened over 8 million people globally. So looking at the numbers and the figures and the number of findings for different conditions, vascular disease and different, say, chronic kidney disease and other vascular conditions, it is quite interesting, and I always find it quite striking to see you find such a high level of disease in people who are apparently healthy. And I say apparently healthy because, obviously many of those, they are not. I mean, they come to you and you do a simple examination, which is a screening program, and then you identify that they are having a serious condition which could be life-threatening. So for example, for abdominal aortic aneurysm, just to give you an example, and I will give you figures in the UK only. So far, we identified more than 3,000 people with abdominal aortic aneurysm in the UK, and it is just in the last 5 or 6 years. And out of which we had more than 300 people with very large aneurysm, which means it could rupture any time. And those individuals are at really life-threatening condition. And if you identify those at earlier stages, you can do elective surgery. And we know that the complication rate for elective surgery in the UK is around 2%, and it is indeed less than 2%. But if it ruptures, more than 50% wouldn't make it to the hospital. And even those who goes to the hospital and go for emergency surgery, many of those will die in the first 30 days after the surgery. So it is apparent and it is obvious that it is good to have prevention and also have a good screening program to identify those individuals at an earlier stage that you can do something about. So when it comes to the some national screening program in the UK since 2009, there is a national screening program which has been introduced, and that one is targeted at male at the age of 65. So they will get invited by National Health Service, NHS, and they go through the community ultrasound screening, and if someone has aneurysm, they will go through a different pathway, and based on the size of the aneurysm, there would be different approaches for them. And so is in the US. It was started a couple of years ago, and then criteria is slightly different compared to the UK, but again, that screening program has been introduced in particular for abdominal aortic aneurysm. There are a few other screening programs, in particular in the UK, which is for which is called Health Check program, and that one is for cholesterol, for risk of diabetes, and in some occasion for chronic kidney disease. And so far it's proven to be very successful, and the whole point is about early identification and then taking action to minimize the risk of a condition.
All right. Dr. Aziz, I have to ask you a question. During the conference or yesterday's Awareness Day, you mentioned a very, very interesting point to me. If we go to the public and tell them, let's screen for cancer, I mean, everybody's going to go and screen for cancer because this is they're so afraid of cancer. But how important is it that if we tell them, let's screen for a vascular disease, how can we make them as interested in vascular disease as they are in cancer?
Yeah, this is a very nice question. I mean, this is the purpose or one of the aims of the Awareness Day is to present the vascular disease as an important disease, because it is one of the most lethal diseases that we are facing in our modern society, and people are not aware about it. Why? Like you said yesterday in the Awareness Day, it's by numbers and by studies that the mortality rate or the death rate from vascular diseases, okay, it's exceeding the death rate from colon cancer and breast cancer. Okay, but when people they hear about breast cancer or colon cancer, they get scared from the cancer. Oh, it's related to death or related to complication. But when they hear the term vascular disease, because they don't know about it, lots of people they don't know about it, they kind of hesitate to go and check for themselves, or they ignore it. You know, and that's why we see the patients usually in our country, in our region, Arabic countries, and especially Kuwait. Unfortunately, we see them late in the late complication when a stroke occurred, or when there is an ulcer, or when there is a gangrene.
Amputation, it's debilitating.
Yes, so we want to catch the people early. The vascular diseases, it's a lethal disease, it's a dangerous disease, but if you catch it early, you can modify it, you can reduce the risk, you can live happily, you know. The vascular diseases, the impact of vascular diseases, the amputation or the gangrene, it's not only on the patient, it will affect his psychology, it will affect his family, and it's a psychological trauma, it's a collateral damage for the patient and for the society that he's living. And you know, vascular diseases are very, very important and very common in our region. The risk factors for vascular diseases, and I'll say it again because this is part of the awareness.
Yes. Diabetes,
hypertension, obesity, smoking, high cholesterol, family history, cardiac diseases. All of these are very, very common in our region, in our countries, compared to the North America or to the European countries. So we imagine that the prevalence of vascular diseases are more common that in their countries. So we have to take the action.
Very true.
Yeah.
What action are we going to take?
Well, the action depends on the severity of disease and the awareness. If you detect the disease early, by screening program, by diagnostic test, by whatever, but the patients come to you, you start to modify the lifestyle, the causes. This is